it just snowballs into more and more hospital needs or medical attention. That's coming from someone that's experienced it. My spouse hit our out-of-pocket max in a day with one diagnosis.
Welcome to Talking Retirement, brought to you by njlifeandhealth. I'm your host, Ken Connolly, and each week we sit down with fascinating guests who share their insights, experiences, and expert advice to help you make the most of your golden years. Today's guest is Jo Gallo. Jo is one of New Jersey's favorite Medicare specialists, where she has helped hundreds of people with their Medicare. She's also a writer for the local publications The Berkeley Times, Corner Cafe, and Moments. Today, we will be talking about one of the biggest costs in Medicare Advantage plans, cancer and heart attack coverage. While these plans offer coverage for these catastrophic events, you may still be stuck with bills totaling thousands of dollars. Jo speaks about her own experience of her late spouse reaching her out-of-pocket maximum in one day after getting a cancer diagnosis, the costs outside of healthcare you may not anticipate, and how people of all ages can protect themselves. You won't want to miss this exciting and important conversation. Let's dive into it. Welcome to another exciting edition of Talking Retirement. We are here with Jo Gallo, Ocean County's favorite Medicare broker again. And because you guys love her so much, we have a couple more questions and topics to go over with you. Jo, how you doing today?
I'm doing great, Ken. How you doing?
I'm doing good. So I think the thing we're going to talk about today is the biggest blind spot in any Medicare Advantage plan, which is, in our eyes, cancer coverage and heart attack coverage. Can you break down the structure of a Medicare Advantage plan so people understand why they might need that?
Sure. So basically, in an Advantage plan, you're not paying for insurance that covers you at 100%. Instead, you're paying either low cost or no cost for a plan that you're going to have to equalize or help pay for your insurance with things like co-payments and co-insurance. And where the issue with that type of plan really gets hard is with those co-insurance payments. And in the event of something major happening to us with an Advantage plan, such as cancer, a stroke, heart attack, any heart issues where there's something major going on, or again, a major cancer issue going on, there are additional insurance products to help people overcome those costs. Those plans are referred to as just what I said, cancer policies and heart and stroke policies. Those policies are available to any American over the age of 18 through the age of 89. So at the age of 65, if you choose to go on a Advantage plan, we suggest that you take a look at it and learn some more about it so you understand your coverage. And, not to keep going on and on, but as with any insurance, the younger you are when you purchase it, the less it will cost you in the long run.
Yeah, absolutely. So quick note for everyone watching, Medicare supplements don't cover at 100%, but they do have really good coverage. So quick note, there are some out-of-pocket costs, but I think the biggest one that comes in when you have a Medicare Advantage plan that might not be advertised to you when you sign up is the out-of-pocket max. So in New Jersey, a lot of the plans have $7,500 annual out-of-pocket maxes with the Medicare Advantage plans, and that's in network, and it could be all the way up to $10,000, $12,000, or $14,000 out of network. So you brought up the co-insurance. How does the co-insurance factor into that maximum out-of-pocket?
Sure. The co-insurance comes into play usually on big ticket items such as major tests, operations, and one that really, is a little disturbing is that it could be an up to 20% copay on chemotherapy and radiation. There is where, you're going to hit that out-of-pocket max, whether you like it or not. We all want to live. We all want to live healthy. We all want to do the right thing for ourselves, the right thing for our families. So when you're going into a diagnosis like cancer, where it just snowballs into more and more hospital needs or medical attention, medical necessity, there's where coinsurance starts to build. And before you know it, could happen in a day. You're hitting your out-of-pocket max. And that's coming from someone that's experienced it, where, we've hit, my spouse hit our out-of-pocket max in a day, and with one diagnosis. And it was terrible. And it took us 3-4 years it took me 3 or 4 years to pay it off. But on the upside, if I would have known that I could have purchased a cancer policy at that time to cover those additional out-of-pocket expenses, or to get coverage to that maximum out-of-pocket, it would have been more comforting knowing that I was covered. Sometimes not having to worry about the most, rotten parts of bad diagnosis is what has to come out of your pocket, because you want to live in the comfort that you've gotten used to living in. And when that comfort gets pulled out from under you, you need help. And a cancer policy, if I would have known, to complement my health insurance at that time, would have given me that lump sum payment. I would not have hit my maximum out of pocket in a day. I would have hit it, but I would have paid for it with cash and still had cash left over to once again provide for the comforts and the medical necessities, like a hospital bed in your home. Now, a lot of us don't even think about that. But it's so much more comforting for someone that's gone through so much and is going through so much to go home into a bed that works with them and not have to just lie flat all the time. Other items that come into play are just getting some help. It would have been nice to have that extra income to afford someone to clean my house while I was being the primary caregiver. And that, was, I hate to say that, a lucky scenario that I had the ability to be that caregiver. You have to think about it from the perspective of, you don't have the ability to be a caregiver, or you're alone and your son or your daughter or your friend or your cousin or your relative lives far away, it's not an easy thing. To be able to afford help is wonderful. Even if it's only 2 hours a day, it's still more than you have to do yourself. Meal preps, cleaning, washing clothes, getting to the doctor's office, all those things cost money these days. Nobody's willing to, go out of their way for you, unless usually they're looking for something in return. We're not post 9/11 right now, where everybody reached out to each other and helped each other. We're kind of in a world where everybody's gotten a little bit secluded in their home lives and not willing to go out and go the extra mile. Mm-hmm. So a cancer policy, I can't begin to tell you how I wish I would have known about it, but it is what it is. Now, on top of that, do you have anything to add on that, Ken?
No, I mean, I think you brought up a great point that on top of the incredible cost of just the medical part of the cancer, there are all those other things you don't think about. Are you taking off work? Is your spouse taking off work? Do you have a stopgap so that you both can stay at home to take care of one of the people? Are you losing an amount of income? So these policies function a lot like life insurance policies, where if you get a cancer diagnosis or a severe heart condition diagnosis, they just give you a lump sum. So you can not only, like you say, pay your out-of-pocket max, you can also take extra money to do the things like you mentioned, like get help around the house, get a hospital bed. It's very no strings attached. So I think you brought up a great point where you might immediately think, okay, we need to pay the medical bills, but there's so much else that goes into it that you might not think about.
Right. And your medical bills will get covered. So a $25,000 cancer policy or a heart policy will afford you to pay that $7,500 maximum out of pocket and still have enough money left over to get the help you need during the times when you need it the most. Not to mention, like I said, the hard equipment, the medical equipment that, again, in an Advantage plan, you're not going to get DME. It's called durable medical equipment. That's medical equipment like a height, a toilet seat with some height, so that the person that's fallen ill is not going to have to pull themselves up or need your assistance. It gives them the integrity and the not integrity, but yeah, I do mean integrity. Cut that out.
The dignity, maybe. Is that the one?
It gives them the ability to still feel like a human being without having to. There's a word for that. I can't think of it right now.
It's dignity. I think you were close. Dignity, right?
Dignity. Thank you.
Yeah.
Dignity. Yeah. It gives you that dignity where, you can still do some things yourself. You don't have to feel that you're completely dependent on someone else. Having someone make you a sandwich is a lot different than having someone in the bathroom with you. Big difference. And again, having a lump sum of cash of $25,000 policy is an incredible thing.
Yeah. Can you dive in? I've always described these type of policies to people as very low risk, high reward. Can you break down the structure of these plans in terms of what you pay per month and what type of cash out you can expect if something were to happen to you?
Sure. Depending on what you believe you need, like some folks feel that they only need to cover that maximum out of pocket. And they're going to let the Advantage plan carry their weight, which is fine because they're there, and maybe it's a spousal relationship where the spouse is healthy enough to take care of them, get them to their appointments, take care of their needs, and so on. It's a great thing. You can cover the maximum out of pocket for about $25 to $30 a month. Again, the younger you are when you get into these plans, the more coverage you're going to have and the higher amount you're going to be able to afford. As you age, that payment each month will go up. So that's basically how it works. If you feel that you want more protection and you move to, say, $25,000, you're covering, again, that maximum out of pocket, and you're affording yourself some additional cash for everything that I was just speaking about, getting the home care that you need, getting the durable medical equipment that you need in your home, not worrying about co-pays or co-insurance. You're covered because you paid your maximum out of pocket and you have a little cash left over, which, it's up to you. It's like Ken mentioned, it's like a life insurance payout. The money is yours. Nobody can tell you what to do with it. You can pay your taxes with it. You can use it to go to the racetrack. Or you can get home health care for the person you love. Completely up to you.
Oh man,
it's true. I've seen. I know the feeling. We had life insurance. I had a large payout when my spouse passed away, and it was. It gave me dignity. I was able to do things that I couldn't do normally. I was having problems paying everything, but there it was. It's a great attribute to, or a great income for when you don't have any income, or when you can't work, or where you just don't feel like going to work. And for seniors, once again, it also gives them the flexibility to not be the only person helping. Like especially if it's spousal or if you live alone. Living alone can be pretty tough. And when you need something and you can't do it, or you can't afford it, or you can't get to it because you don't feel well, it's even harder. It's really hard. Mm-hmm. And again, having the extra income is a wonderful thing. I think one of the topics that we should also really, really get to is the fact that if you can't afford this as a senior on a fixed income, you have to remember that just because you're the beneficiary, or you assign a beneficiary, if you have children or friends or relatives that are willing to pay for this, it's like a monthly subscription. I mean, there's commercials on TV these days asking you how many subscriptions you have. It's no joke. People sign up for things, get signed up, automatic, intro into a subscription that they didn't even plan for. They don't even realize they're paying anymore. It's the same scenario. $25 a month is highly affordable for someone that works, has an income, and it's, many, many subscriptions. And, I believe it's affordable. I don't want to put my words into anyone's mouth, but, I'm paying for Netflix right now. It just went up $10. I'm still going to pay for it, and if I had health insurance, well, I do have life insurance. It doesn't go up every month. It costs me $29 a month to be exact. And it covers everything that I believe I'm going to need.
Yeah, I think building off that point, people a lot of times say I might not be able to afford it. And we totally get it, because we do have a lot of clients that are on fixed incomes and every penny counts. But I always kind of think the counter is, well, if you can't afford this, you definitely can't afford the cancer care when it actually comes. So and I think it's a good way to look at it, where maybe you do have, a sister, a spouse, a child, someone who can afford that extra 20, $30. It's really going to save you in the long run if something were to happen. I think some of the saddest conversations we have are when people come in at the end of the year. They're probably not our clients, but they come in and they say, hey, I just got hit with a $10,000 cancer bill. What can you do about it? So unfortunately, we can't, because the best time to do it is beforehand. That's when you can actually get these policies. So it's not something you want to wait around for.
Right. And the way cancer is exploding in this country, the way cancer is exploding in this country, and heart disease, especially among women, has been growing exponentially. I mean, it's time to put a little bit more care and a little more thought into your health and how you want to be taken care of, versus, oh, I don't have it, I'm not going to have it, I can't get it, I don't want it. Who cares? You got to start caring. We're not getting any younger. As we age, more and more goes wrong. This is why, our agency, NJ Life and Health, is always so proactive in trying to explain every bit to our customers. I mean, our education takes about an hour. We don't shy away from any of it. We tell you bluntly, this is what it will cost. This is what it will cost when you are diagnosed with this. We may not be 100% on the money, but we know. We've watched it happen. We've had many a person come to us from other agencies and say, what can I do? And it's a very sad moment when we say nothing, because they've already been diagnosed. The issue behind a cancer or heart policy is that you are pre-diagnosis. So once again, I reiterate to the fact that you really need to be at your youngest point in time. Don't wait until you're 85 and say, oh, I'm going to cover it now, because the $25 policy that you could have bought at 65 is now going to cost you probably $165 for a monthly payout just for $10,000 in the event you get cancer. I don't know. That doesn't make much sense in my mind. Cover your bases now, take care of yourself later, and not have to worry. Insurance. I always go back to the basics when I talk about insurance. Insurance removes the risk of not having what you need when you're diagnosed. That's what it is in this case. An Advantage plan will cover your medical expenses, but you're going to pay money out of pocket. And you're going to pay, as Ken mentioned, $7,500 is the New Jersey kind of average. Some Advantage plans, it's a little higher. Very few, it's a little lower. But all in all, you're going to pay out of pocket. And even with a supplemental plan, you're going to pay out every month. And like Ken mentioned, they don't cover everything. They kind of cover most. But why not protect yourself?
Yeah, I like the way you put it, too, because with a supplement, there is very comprehensive cancer coverage built into it. In terms of they're effectively the same thing. I can't get into the bells and whistles. I don't want to disparage Advantage plans too much, but with the supplement, a lot of your out-of-pocket medical costs are lower in most instances. There's obviously going to be exceptions, but like you said, there might be things outside of medical that go under the scope of insurance that need to be paid for, be it you needing to take a month off work just so you can help pay for them. So even if you're already paying for the supplement, it might make sense, like you said, to spend an extra 15, 20, 25, $30 just to really get ironclad protection and make sure everything is okay.
So, like I said, when I compare it to a subscription, I'm really being honest there. You're paying $25 for Netflix, $25 for a cancer policy. In the event it happens, you're covered.
Yeah.
You know?
Yeah. So if you have a Medicare Advantage plan, or honestly any age, it's never too early to have this conversation. Young people are having cancer earlier now, particularly colon cancer I've seen on the rise. So no matter what age you are, we always talk specifically for Medicare Advantage plans, but no matter what your age is, it makes sense to talk about a cancer policy, talk to your family about cancer policies. And if you have any questions or concerns, you can always reach out to me or Joe. We'll give you an honest appraisal of what you need in terms of cancer benefits, heart attack benefits, life insurance benefits, everything like that. So, Joe, if people want to work with you or the people at NJ Life and Health, how should they reach out?
Oh, you can give us a call at 848-226-6897. You can feel free to come on down to our office. We're located at 600 Mule Road in Toms River, New Jersey, right in the middle of all the holiday cities. We get a lot of senior clients because of where we are, and it's given us the opportunity to learn what they need. Makes us kind of, I don't know, I feel like we're a little above the crowd because we worked with so many seniors for so long. We watch this stuff happen every day. We hear about it every week. We discuss it every week as a group of agents that care. I cannot begin to tell you that when I walked in this office for a job, I felt like I was at home. Let me tell you that phone number again. It's 848-226-6897. Please come see us or give us a call. Ken and I, and we have other agents on the team here, we will help you.
Absolutely. And I think the last thing I want to leave is, Joe, what are the newspapers you write in regularly? You're in quite a few locals in Toms River, correct?
Yes, I write the Medicare piece in the Berkeley Reporter, the Cafe Corner, and now newly on my list of publications is Moments, which happens to be in Jackson. Those local little newspapers that come out from the clubhouses are very informative. They give you a lot of local help. We don't particularly advertise in there because I write the articles for them. But again, our word of mouth around, just ask anyone. A lot of people know us. A lot of people respect us, and a lot of people are grateful for us because we explain everything in detail so they know what the expectations are. You never walk out of an office here at NJ Life and Health wondering what something's going to be, because you will have one of our cards in your hand where you can give us a call and find out the answers to your questions.
Heck yeah. Well, Joe, always good to hear from you. See you in the next one. And once again, if you need any help from us, feel free to reach out. Thank you.